As we analyzed Medicare, we found a startling statistic. 5% of Medicare beneficiaries, 5%, use half of all the money. Who are they? They're the chronically ill. People who have multiple serious conditions. We are wasting massive amounts of money and getting worse healthcare outcomes than we could if we better coordinated their care.
So pleased with it and very upset that it could come to a halt.
I no longer take blood pressure pills. I used to take Prinavil every day, in the morning and the evening.
You stay home because you're afraid to go out, afraid to walk, and this program has overcome that for me.
My doctor is very much aware there's somebody besides me that is concerned about my health.
She saved me a lot of trips to the doctor and given me confidence that I have someone to talk with and will help me decide when I really need medical attention.
Gives me a chance to get into a routine that I otherwise wouldn't be really doing.
Keeps us seniors motivated, and it keeps us healthy and keeps us moving and away from doctors and hospitals.
The nurses check up on you every month. I'm able to lead a normal life even at my age.
Morning. When I first came, I said to Mary Ellen, I said, I'll tell you what I'll do. My time's precious to me. If the program works, I'll continue. I'll give you 3 weeks. Within 2 weeks, I started to see results which made me feel good, and I have probably saved my life.
And it was also helpful to be part of a group that we would get together every week, and people like myself would talk about our common experiences, and I enjoyed meeting those people, look forward to seeing them every week, and I benefited from their experiences.
Period of time. And it doesn't necessarily mean Avandia is a terrible drug, but maybe what it's pointing to is maybe it's not going to be appropriate in some people with certain risk factors.
We go over various articles that are in the newspaper or health-wise, and then we do a period of 40 minutes of exercise.
Age.
Then what?
Overweight.
Overweight.
And inactive.
Inactive.
And having a poor diet.
Oh.
3 out of the 4 you can do something about. 3 out of the 4. So you have control over this situation.
And it changed my whole way of eating and thinking of food. Before, we used to have meat and potatoes and maybe a vegetable. And now it's 2-3 vegetables and a salad and more fruit. We've learned how to eat better. It also helped me when my husband had a heart attack to be able to recognize what was going on and get him to the hospital quickly. I think I did not call the doctor for every little thing before. And since his heart attack, yes, you're more nervous with things that are going on, and therefore I can talk to her to know, is it something to worry about, or should I contact the doctor? Because doctors are busy and they don't always get you in right away, where Mary Ellen will assess it and answer your question right away, what's wrong and what to do.
About 8 years ago, our family doctor suggested to Bill and me, my husband, that we get involved in a program that was being started by Medicare. It's one of the best decisions we ever made. I've attended every week, twice a week, and it's just been a tremendous, really, crutch for us.
Circle your shoulders back a couple of times.
I've also had problems with balance, and it was recommended to me to take the exercise classes here, and I see a very big difference in my balance and in my walking, feeling better.
Halt. Halt. Everybody breathing?
Most older people don't get out very much. They have relatives who'll take them here and there, and I know lots of them hate to ask for any kind of help. And I look forward to coming to these sessions. It's not too long, it's only maybe half to an hour or so, but I enjoy them, and I look forward to meeting the other people that come. I've made quite a few friends that way, which I would not have done if I was unable to come to these exercise classes.
So I feel that the program has been very beneficial, and I listened to a great many of the hearings on health care before the House and the Senate, and one of the things that all the health professionals were saying was that preventive care was very important, and that it was important to have programs where people could monitor weight loss and heart and things like that. And I thought, you've got a program like that here, and it's very successful. And a lot of us are depending on it, and it would be a great shame to have it discontinued.